Slide number 2 is the learning objectives. By the end of this lecture, you would be able to define health, illness, contrast between acute and chronic illness, differentiate between communicable and non-communicable disease, and list the common communicable, non-communicable, and genetic diseases as they occur in Oman, and appraise the common methods of prevention of disease. Now, the definition of health is variable. Different people use different definitions of health, and one of those definitions is efficient performance of bodily function taking place in the face of a wide range of changing environmental conditions. In other words, for example, if it is too hot, if it is too cold, if it is if there are viral infections around, and even then the bodily function remains normal and the efficient performance continues. That is the definition of health. However, the more widely used definition of health as suggested by the World Health Organization is as follows. It's a state of complete physical, mental, and social well-being, and not merely absence of disease or infirmity. And I think this definition is something that you need to think and reflect. How do you classify illness? The illness or disease can be classified in many different ways. For example, a physical illness or a psychological illness. And now we know in the last 15 to 20 years that many times psychological illness may actually cause part of the physical illness, the so-called biopsychosocial model of illness. And this is something which you would be studying through this course as well. The illness can be acute and short-lived, or it could be chronic and ongoing. The illness could be self-remitting. For example, most of you might have developed sore throat in the last few years, and then it goes away by itself after 5 to 7 days. Or it could be remitting and relapsing. For example, many of you may have uncles or aunties who have diabetes or high blood pressure or rheumatoid arthritis or osteoarthritis, and those diseases never go, but they are still there. The disease could be curable. For example, an appendicitis, tonsillitis, malaria, many infections, or it could be manageable. For example, diabetes, high blood pressure, arthritis, etc., so on and so forth. The disease could be communicable. For example, the infections, and we will discuss those in more detail in a little while, or they would be non-communicable. In other words, they do not spread from one person to the other, or the disease can be classified as genetic in origin or environmental. Slide number 5 shows you some important data, and you do not have to remember all the numbers over here, but all that means here is that in men, the average life expectancy in Oman can be seen on the 6th row, and it's 75.6 years, and in women it's almost 4 years more, 79.9 years. And this compares with the average life expectancy in United States, which is not too far, and many other countries, even countries like Japan, etc., where it is slightly higher than Oman, but not too far away. I think what is also would be important and good to know is that over the years, for example, in this chart you see that from 1990 to 2016 the average life expectancy of both men and women has increased in Oman from around 70 years to 77 years in men, and from around 72 years to 79 years in women. Now this slide, the slide number 7, in the middle you see this spectrum, which is darker on the lower end and lighter on the upper end, and that's a spectrum. And a spectrum means that the disease does not have to be totally environmental or totally genetic in origin. However, there are some diseases which are like that. For example, An environmental illness could be a road traffic accident. One does not have to be genetically predisposed to have a road traffic accident, or a person who falls off from a building, for example. Those sorts of accidents are totally environmental. On the other hand, there are diseases which are totally genetic and without any environmental influence, such as the autosomal recessive disorders like sickle cell disease and thalassemia, which are common in Oman, or hemophilia, which is not so very common in Oman, etc., so on and so forth. But what you see is that usually there is an interaction between the genetics and environment, in the sense that people who are genetically predisposed can be influenced by the environmental factors and disease may develop. And what are those factors? Those factors are infection, allergic disorders like asthma, inflammatory disorders like rheumatoid arthritis, nutritional disorders can occur, for example, deficiency of vitamin A, C, D, B12, for example. And then there are lots of vascular and metabolic factors. Those constitute the non-communicable diseases like cardiovascular disease, ischemic heart disease, diabetes mellitus, etc., so on and so forth. And then obviously the neoplastic disorders or cancer. What you see on the right side of the screen is seed and soil hypothesis. What is seed and soil hypothesis? Means that for a seed to grow, it has to go into the right soil, and only then it grows. So here it is that environmental factors many times would produce disease if they occur in genetically predisposed individuals. Slide number 8 actually shows that most of the diseases, in fact not all but many of the diseases, they follow a pattern or a full spectrum, which starts from prevention, early detection through screening, then diagnosis, treatment, and follow-up, and then either the person is cured or goes into terminal supportive care. And the first two parts, prevention and screening, those occur in community care, something which you have probably observed and read a lot in your previous course in the hospital and community attachment. And the last four boxes of diagnosis, treatment, follow-up, toxicity, and terminal supportive care are mainly seen in the hospital care, which you would be seeing over the next several years. Now, the prevention in community care can take three different forms: primary prevention, secondary prevention, and tertiary prevention. And what we want to highlight over here is that primary prevention is for diseases out there in the community, in the schools, etc. For example, right now there is a primary prevention strategies for COVID disease throughout the world, which includes obviously school closure, not going to the restaurants, physical distancing, not shaking hands, wearing a mask, hand hygiene, respiratory hygiene, and now waiting for the vaccines. So all of those are primary preventive measures. However, in people who are genetically predisposed, for example, those people who are obese are at a higher risk of developing heart disease or diabetes or cancer, then to prevent those diseases, you adopt measures what is called a secondary prevention. And if the disease occurs in one person and then that person survives that disease, then the measures taken to prevent the disease from recurring is called tertiary prevention. And beyond prevention, there is obviously early detection through screening methods. We would be seeing some of those towards the end of this course when we talk about asia. So this slide once again shows you something which we discussed on the previous slide. The slide number 9 talks about primary prevention, the general hygiene, drink clean water, wash your hands, stay away from people who may have infected, hand hygiene, and then the vaccines. And obviously all of you have received vaccines according to the expanded program of immunization, which you have read about in the hospital and community attachment course last semester, and you would read more about it this semester and in the semesters to come as well. Then there are secondary preventive measures, which include vaccines, toxoids for people who are at a higher risk, and then the tertiary preventive as well. Now, the disease develops because there are certain risk factors in us, and those risk factors can be broadly classified into two categories: the modifiable risk factors and the non-modifiable. Let's look at the non-modifiable on the right hand side of the screen first. Increasing age predisposes to cancer and diabetes and high blood pressure and ischemic heart disease. There is nothing that one can do about it. So that is a non-modifiable risk factor, except to know that this can happen with increasing age. Race and ethnicity. There are certain diseases which are more common, for example, in the Chinese or in the black Negro or in the African population or in the Ashkenazi Jews, etc., so on and so forth. So that is again, it's they occur in there. Family history. Sometimes a family history of breast cancer or a family history of some other diseases like ischemic heart disease and diabetes predisposes individuals to a higher risk of getting same diseases, and there are other predisposing illness. But I think the more important thing is to look at the column on the left hand side of the screen is the modifiable risk factors. Lots of diseases can be prevented by modifying the lifestyle. Do not smoke. Do not be physically inactive. In other words, do exercise 30 minutes a day, every day of the week. Eat a balanced diet, and we will come back to that. What is a balanced diet? Do not drink alcohol. Do not abuse substances. Prevent obesity from developing. Treat high blood pressure, treat high blood sugar, and treat high cholesterol. All of those risk factors, if they are treated, if they are circumvented, you can help to prevent this. Now this slide number 11 is actually an interesting slide. These are data from Oman. You don't have to remember the figures over here, but what you see is that almost 2/3 of the diseases in the maroon color, blue, or the gold, green, and the gray color are what is called as the non-communicable diseases, which means that the disease do not spread from one person to the other. Almost 70% of the diseases in Oman, or almost, let me rephrase it, almost 70% of deaths in Oman are caused by non-communicable diseases, whereas only 30% of deaths are caused by communicable diseases and by injury, which appear in blue color. The common genetic disorders as they occur in Oman, and this is from that particular source, Dr. Anna Rajab and Dr. Muhammad Ali Jafar published this some time back, and this is available on the internet as well. You can Google it, or you can go on the PubMed and look for this reference yourself if you are interested. But the autosomal dominant diseases are listed over there. I think at this stage you probably want to know at least 2 or 3 diseases a little bit. Adult polycystic kidney disease, the different types of deafness that occur, tuberous sclerosis. If you know those 3, this is because some of you have asked these questions since I did the lecture this morning. So I think those 3 diseases, keep those in mind. Autosomal recessive disorders, I think keep in mind about sickle cell disease, beta thalassemia, alpha thalassemia, and cystic fibrosis. Those are common diseases. You would see a lot of those when you come to clinical years, and even now in the phase 2 as well. During your system courses. The sex-linked conditions like G6PD deficiency is very common in Oman. Almost 1/3 of the population, 1/3 of yourself may have G6PD deficiency. So this is something to know about. Chromosomal disorders are also not uncommon in Oman. Down syndrome, there are lots of patients with Down syndrome, so they need to know a little bit about Down syndrome as well. And then inborn errors of metabolism, just the classification of diseases, some endocrinopathies, for example, deposition of substances in thyroid gland, pituitary gland, or pancreas can lead to all sorts of endocrinopathies. Amino acid metabolism, acid ureas, and mucopolysaccharidosis are the common inborn errors of metabolism. But in all, they constitute about 10% of all diseases in Oman. Here is the list of the 4 most common non-communicable diseases, and almost 70% of deaths in Oman occur because of either ischemic heart disease, diabetes mellitus, chronic lung disease, and cancer. And that is where I think you need to know this at this stage, because it's your opportunity as medical students to talk to the public about prevention of those by looking at those modifiable risk factors that I showed you on one of the slides. Now we come to communicable diseases, and this particular course, Response to Infection and Pathobiology, I think almost 70 to 80% of this course would talk about this particular part of the disease spectrum, which are the communicable diseases. They will talk about the pathogens. A pathogen can be either a virus, bacteria, parasite, or a fungus, and you would have detailed information of those from the team. The common communicable diseases, as they are seen in Oman in the general practice, are varicella, which is herpes simplex virus, and occasionally herpes zoster as well. Sometimes children particularly, they present with fever and rash. Then malaria. Almost 1,000 cases are diagnosed annually in Oman, but most of those cases are imported. They do not occur in Oman, but they come from either Southeast Asia or from the eastern part of Africa. Acute hepatitis, about 300 to 500 cases are diagnosed. Food poisoning, once again 300 to 500. HIV, new cases, almost 150 cases are diagnosed every year in Oman. And then tuberculosis, and the numbers are increasing over there. This slide number 16, and I think some of you asked about why there is a difference between the previous slide and this slide. These are actually patients who were diagnosed to have those infections and admitted to the hospital. And as you can see, this is an old reference, but basically it tells you that there have been studies from Oman. This particular study was published in American Journal of Tropical Medicine and Hygiene in 1999, so more than 20 years back. And this was published by one of the faculty here, Dr. Johan Scrimger, who worked over here for several years in Department of Medicine. And what he saw was that the commonest causes of hospitalizations were tuberculosis, brucellosis, gastroenteritis, hepatitis, and then HIV and leprosy as well. I think this is an important slide. We talked about it in the morning as well, and in my previous recording as well, and I will just very quickly like to go through it once again. The normal response to infection can take either the form of inflammation, which is either acute or chronic, and different cells and cytokines are involved in generation of acute inflammatory response or a chronic inflammatory response. Or infection can the body can have its own mechanisms to prevent itself from the infection and develop immunity, and that immunity could be either you are born with it, called the innate immunity, or this immunity can be acquired, such as by the B and the T lymphocytes. And you would have lots of information in this course about the innate and the acquired immunity, and you would learn about it. Or in some cases the whole body, there is a response, and that is why it's called a systemic inflammatory response syndrome, or SIRS. And in the presence of bacteria or the organism, that is known as sepsis. So there is a definitive diagnosis of sepsis, which is SIRS in presence of bacteria. Sepsis could then go on to become either severe sepsis or septic shock, and that is something which again you would be learning during the course of this particular course on response to infection and pathobiology. You would also be learning a lot about the treatment of infections, allergy, and sepsis, and that would be the pharmacology and therapeutics. And towards the end, we will be discussing about how cancers develop. Some of the cancers actually develop because of the infections, and we would see that in etiology of cancer and the infections. The last 2 or 3 slides talk about the immune function or the immune system. An immune system is the defense against the any invading organism or cell, which could be either a microbe or a tumor cell. Slide number 19 here shows the organs which offer immunity, and these organs actually provide innate immunity. In other words, we are all born with it, and the infections are getting in. The cells, which are very important part of the immunity, the T lymphocyte and the B lymphocyte and the natural killer lymphocytes, and I think this is going to be very exciting part of the course, when you would learn about how the T and the B lymphocyte talk to each other using some cytokines and some other substances and other factors. And then obviously there are the other types of cells, the monocytes and the macrophage and the granulocyte, which are called the antigen presenting cells, and those also have the immunity. Slide number 21 tells you about the molecules. You would learn about the antibodies, complements, cytokines, and interleukins and interferons, which are all part of the